Hello, everyone, and welcome to this special episode of Pharmacy in Phlux. I'm your host, Derek DeRose, alongside with my co-host, Phil Hauser. You know, Phil, throughout the last few weeks in the media, we've seen a lot of coverage of the COVID-19 pandemic, and it seems that a lot of the recognition that we're hearing from the healthcare officials and public health officials and politicians is being showered on frontline healthcare workers such as doctors and nurses, care aides, first responders, and even on food workers, grocery store clerks, and the like. But they never seem to mention pharmacists. And we know that pharmacists are working very hard under suboptimal conditions in many cases these days to help patients stay on track with their medications and to help guide them through the reality that we're living in now with the COVID-19 pandemic. So today, to give us a little bit of a sense of what it's like to be on the front lines in a community pharmacy and how pharmacists are coping along with their staff with this pandemic, we have two terrific guests with us. Joining us on the program today, we have Michael Millman, who's the pharmacist owner of Delta Prescription Clinic located at Scott Road and 84th in Delta. I believe Michael's been there since 1985, if I'm not mistaken. And pharmacist owner of Kerrisdale Medicine Center Pharmacy located in Kerrisdale in Vancouver as well. So Michael and Colin, welcome to the show. Glad to have you on board today. Thanks for making the time.
Thanks for having us.
Thanks.
Well, it's a pleasure. So let's just jump right into this. Starting with you, Michael. Looking back on your, I guess, 40 plus year career now as a pharmacist, have you ever seen anything like this current pandemic?
No, there's never been anything like this as long as we've been functioning and working in our lives. It's taken us not only from a health perspective, but from an economic perspective, from a personal perspective, from a patient perspective, from a staffing perspective. It's hit us from all directions. And if I could just add one little comment to your intro, not that people necessarily forget about pharmacy because the patients know we're there, but it seems maybe we're not grouped with healthcare professionals at the right time. So I think we need a little bit of more of a pat on the back and a little bit more push up to the front, because at this time, I think all of us are really providing a really important function.
Couldn't agree more with you, and that's one of the reasons that we're doing the program today is to help get that word out exactly. How about you, Colin? What's it been like for you? Have you ever seen anything like this?
No, it's never been anything remotely like this. This is unprecedented, and I think we were all kind of caught. I don't want to say off guard, but we were caught a little bit. And when the wave hit in early March, the wave hit, and it hit hard, and we were blitzed, as was every single pharmacy out there. I think every single pharmacist was taxed to the max. And the funny thing is, you're so ingrained in it during your day to day. There was no time to even catch your breath or even have lunch or anything like that. You started early, you got home late. You have no idea what was going on out there in the world. And this whole event was unfolding day to day, hour to hour, and there was information being released hour to hour. We had no ability to get that information at that time because you're absolutely in the trenches, going at it, explaining, talking to patients. The phone is ringing, the lineups outside are happening. And it wasn't until you got home that night, late, if you had any energy to go on and say, oh, this is what's going on. We would get the emails from the College of Pharmacists and the BC Pharmacy Association, and then you get updated that night. Next day, you would repeat it, the same thing. And it was unbelievable. The information that would happen day to day, hour to hour, was changing dramatically, and we couldn't even keep up because we're just in the trenches, in the fight to get things done and to help the patients. So yeah. I'd never experienced anything like that.
Just following up on Michael's comments, it still remains a fact that pharmacists are the most accessible and trusted healthcare workers. And it's interesting, as you said, Michael, that the pat on the back just isn't there. So hopefully this will help. Just following up on Derek's question for you both, how is this different? This pandemic different than SARS was back in 03, 04, and perhaps the 2019 H1N1 pandemic. Is it really scaled differently for you guys? Colin, why don't you start with that one?
Yeah.
Sure. It's a completely different scale. The SARS epidemic, or whatever you want to call that, it was the only thing that we really noticed in that, we sold through a lot of N95 masks, and it was very challenging to get them, but we did sell them and we had them. There was no push or run on medicine. Patients weren't, phoning us for early refills, concerned that they couldn't get the medication. There was none of that. It's completely a different baby. Mike?
Well, if I could add just onto that, the difference I find is more the fact that, yes, it was an epidemic, and yes, we had to worry about our patients, but we felt that we had some control. We felt that there was a limitation to it. This pandemic has hit us from all sides. So people feel completely out of control. So it's not only the fact that their relatives and their families are getting ill, some extremely ill, maybe some dying. It's also the fact that they're losing their jobs. They can't get their drugs. Some of them can't pay for their drugs. They have no income. They can't pay the mortgages. So when you add life stresses onto health stresses, it just goes crazy. And I think what we try to do is calm it down a little bit and say, look, let us stress about your drugs. Let us deal with that. And that's the only thing we can necessarily have control of in their lives. So yes, SARS was big, H1N1 was big, but this is at a whole different proportion.
Yeah.
In terms of staffing, have you had to make serious staffing changes during this process? And sort of a two-part question. So, your staffing needs, but also how's your staffing been in terms of trying to keep social distancing, with the staff, with your customers, and, how has this affected your staff more on a personal level? If you could kind of unpack that a bit for us. Maybe Michael, you could start with that one.
So my dispensary is slightly smaller than Colin's. We have about 8 or 9 people behind my counter. So social distancing is not a very easy thing to do. What we try and basically keep out of everybody's bubble zone. We're not reaching over people. We're trying to stay away. We're turning away when we have to pass people. So we're doing the absolute best we can and understand that our staff is as concerned for themselves as the family is, any other patient is. We're certainly doing our best in the front of the store to ensure that there is social distancing, but it's very, very difficult in the back. So from that perspective, I think there's not much more we could be doing. I don't know where else to go with that other than that. The fact is, we're all concerned, we're all aware, we all do our best, but we also have to work and get the stuff out.
Yeah,
Colin,
we're kind of the same way, Mike, because our dispensary is a little bit larger in size. Same kind of thing, 10 or 11 people in the back end. It is an impossible. There's an impossibility to actually social distance in that setting, but you do it with respect. So everyone has been told to just stick to their own workstations, stick to their own phones, give people a little bit of space if you can. But we're rubbing elbows there, and that's a challenge. What I have told my staff is you kind of have two families. You have your family at home that you're isolating with in the evenings and on the weekends, and you have your family in the pharmacy. So respect that and be healthy, get your rest, be as healthy as you can, and respect the process of social distancing and isolation. So hopefully it'll work, but yeah, it's in order to do the job, it's impossible in the pharmacies to really abide by all that social distancing.
Do you find your customers are your customers stepping up to practice social distancing as much as they can in the sort of front of the store? I mean, if there's stories out there of people, for example, in grocery store lineups, and I'm curious to see if this has happened in your own pharmacies, where somebody will come up too close behind another customer and they're asked to back off, and they snap, they lose it, dropping a lot of unsavory language and so on and so forth. Have you had any of those kind of experiences with customers in your stores?
Yeah, we
Well,
did. I mean, earlier. Sorry, Mike. We did
no, no, no.
earlier in the process. Lately, it's not been bad because I think it's just now part of this is just how it is now. This is the new norm. But earlier, it was a bit challenging to have those discussions, and a lot of people
Yeah.
would be in the pharmacy just simply having social uh, uh, conversations in the middle of the pharmacy. They run into a friend or something, and we have had to ask them, please, you're going to have to step outside. So I think maybe Mike, now it's a little bit better. I don't know what you find in your pharmacy.
Well, I'm sure you probably done the same. We put the lines on the floor of where people should stand and how far they should be apart. If someone drops up a prescription, they drop it off. We have them wait outside in the lobby. If someone's
Right.
towards our till and someone else is there and they're waiting, we ask them to back off and move to the side. And I find maybe it's because we're smaller stores, not a corporate type of stores. People tend to give us that respect. I have not seen anybody yet in my store be upset with us. They understand it. And what I try and tell them, look, we feel we're here providing a really important function. We're trying to do our best to keep ourselves safe and keep you safe. So if you can help us out, we're happy with it. And I really haven't had a lot of negative feedback at all.
Well, that's good to hear. So that's a good segue, and have you done anything else other than, for example, marking the floors to give people a sense of social distancing requirements in terms of physical changes to the pharmacy? A number of pharmacies I'm aware of put up physical barriers at the pharmacy counter, a plastic or plexiglass shield. Have you guys done anything, Michael, in your pharmacy along those lines?
I just got it yesterday. So I mean, it's taken time.
Yeah.
We're ordering ones. We're not ordering 50.
Right. Right.
The guy who put my shield in told me he just did 500 for the Royal Bank. So, I'm one.
Yeah.
So you gotta know someone who knows someone to get these things done. But you know what? It may or may not be helpful. But what it does is it gives my staff a much stronger sense of safety and security. So I personally don't like it because, as you know me, I'm a people person, much like Colin. We like to get out there and rub elbows and do the things we do. But even I feel a little bit more secure having this see-through barrier. It's going to take a lot of time to get used to. And the question is really, is it ever going to come down? But I mean, yes, it's in.
Okay. How about you, Colin?
Yeah, we also did the plexiglass shields, and we kind of got in sort of medium early, and we got them within about 3 days when we did the order, which was remarkable. They actually look pretty good. In fact, you can barely even see them; they're so clear. They actually look good. I almost want to keep them going on, but they do give you the sense of something, of some sense of security. And I think the patients actually, I was thinking, what are they going to say? Patients really kind of respect that, although a few of them kind of like to try to talk around them,
Yeah.
And so, no, dude, you're right here. There's a reason for them. So we put those in both at the front counter, cash counter, and at each of the pharmacy pickup and drop off stations. So they're all there. It looks good. We, and Mike, I'm sure, does all of this. We sanitize, we do it on the hour.
Every hour.
All the counters, all the railings, the phones, the computers,
Pin pads.
everything. Pin pads are done even more frequently as you are, Mike. So we're doing everything we can do. There's hand sanitizer everywhere in the pharmacy for patients to use. So we're doing what we can.
So what are some of the common questions you're getting from customers as they come in? Is there any central theme or the questions about this pandemic and how it affects them all over the place? What's that looking like? Michael, why don't you start with that one?
I have to be honest, when I get a phone call every now and then that says, I have a sniffle, I have a cough, do I have the COVID? Because people are panicked, but honestly, we're not getting a lot of questions like that. I don't see a lot of that. And, we tell them the same story: stay safe, wash your hands, don't touch your face. And if you think you're having issues, then you need to call the hotline or speak to someone. But really and truly, we do not have a lot of people calling us and worrying about symptoms and stuff like that. Okay. I don't know about you, Colin, but
yeah, we're not getting that as much as well, Mike. What we are getting is Do you have this product? So as March was unfolding, it seemed like every single day there was a new thing that patients were coming in asking about. And again, because we're not really accessing the internet or social media during the workday, and we're getting absolutely blitzed with work, we have no idea what and why people are asking. So
Correct.
initially it was obviously the masks and the gloves and whatnot. Then it was alcohol, well, hand sanitizer first, and then all that ran out. Then it was alcohol, then it was aloe vera, then it was vitamin supplementation. So every day it was something else. So people are always asking about that. And those are the questions that we're getting a lot of. The other question, of course, is, do you have enough of my medication? I better fill my medication early. I'm not sure. And then we would try to sort of calmly say, yes, the supply chain is fine right now as long as we, respect it and maintain it. And there was a lot of explanation, especially through March, about trying to calm them a little bit, the patients, and tell them the truth. Yes or no, there is a problem with the supply chain, but it was tough. You're dancing around a little bit, trying to basically say, look, don't, for lack of better words, don't hoard the medication. And we didn't say it that way, but we're just saying respect the supply chain. So we have had a lot of questions about that, like endless questions on that.
Well, that's a good segue to something else we wanted to explore a bit with you guys. Is, first of all, are you both, like almost all pharmacies in BC, are implementing a 30-day supply limitation on most prescriptions? And second of all, how are patients reacting to that? I heard yesterday that the minister has received over 6,000 letters from seniors and from senior groups complaining about the additional dispensing fees that people are going to have to pay, in particular seniors who may be on fixed incomes and fixed pensions, around all of this. And as you are probably aware, Dr. Bonnie Henry, in one of her daily briefings late last week, said that was something that was being worked on in terms of finding a way to pay those additional second and third dispensing fees that people wouldn't normally have to pay if they got a 90-day supply. So, Michael, from your end, how are people reacting to a 30-day supply? Are you implementing it on a regular basis?
Several ways of answering that. One, of course, we have the chronic patients who've been on a chronic medication who are really panicked about not having a supply. What we do tell them is, look, we try and procure our meds as best as we possibly can. And we're trying to keep stuff away for our regular patients. So we're trying to do our best for that. Some patients are or will try almost anything they can to get a 3-month supply from us and a 3-month supply from somewhere else. And we try to explain to them, look, there's just not that much going around. People who are, there was some news reports about there are no drug shortages. I'm not sure if the people who wrote that article spent 10 minutes in a pharmacy, because I can get prescriptions for a patient where I have to change. If there's 2 scripts, I'll change both of them because nothing's available. So it would be very helpful for the media to maybe take a look at what really is going on, because if there were no drug shortages, why does Pharmacare have a spreadsheet for us to look at every day to see what's available and what's not available? So we try to calm their fears by telling them we're doing our best, we're keeping those meds available. If everybody really does, just as you would social distancing, please respect the 30-day limit. It's not something we're doing because we want to do it. It's not something that has come about because we want dispensing fees. If there wasn't a pandemic, we'd be doing what we're normally doing. So why can't everybody has to adapt during this pandemic? This is just one of the ways of adapting. I would say most of my patients get it and appreciate it.
Good. How about you, Colin?
Totally agree, Mike. I mean, I think what happens, I don't think any of us in the pharmacy world are taking advantage of this situation and thinking, hey, my God, we can fill prescriptions monthly and make a pile of money. There isn't. That's the last thing that's even in our minds. What we're trying to do is manage the supply chain, and much like how we've been selling the surgical masks that we've been able to get in, we just limit it to one package of 10 masks and per person, because we're trying to explain to people, we're trying to allow as many people an opportunity and access to it. So same thing with medication. And we haven't necessarily implemented a 30-day restriction on medications. We do talk to patients, and some of the medications which have been had a bit of a blip in availability, like some of the inhaled medications like Ventolin or salbutamol and such, we've just limited patients to one at a time and explained to them. Most of the time they understand. I understand the financial pressure on some patients. It is what it is right now. But what we are, the pharmacists have a lot of rules. Obviously, we're looking after the best interest and health of the patient. We advocate for a patient with their doctors. We also have a role in supply chain and actually being the gatekeeper to the medications, because if we allow patients just to stockpile a few patients here to do that, and you're suddenly running out of medications for a whole number of patients, where does that sit? How good is that? It's not good.
Yeah, for sure. And so let me ask specifically, have either of you experienced a run on or increased demand for hydroxychloroquine?
I have not. I have not.
You haven't? Wow.
No, I have not.
You
And really, Colin, you've had scripts for it, or?
We had a big push for 1.5 weeks. So just the latter part of March, when Donald Trump was talking about it in the United States about this miracle drug, hydroxychloroquine, and everything, we suddenly, and again, we're in the trenches. We don't even know what's going on that day. He has a media release, a news release that morning. We have no idea. Everybody, the phone are lighting up, and people are coming in asking about. Totally mispronouncing the name of it, by the way, or not even remembering the name of it. And then we're finally realizing it's hydroxychloroquine. So we had a ton of questions on it. We had some doctors asking about it as well. And luckily that whole thing got a bit of a reality check a week and a half later when the licensing bodies of pharmacy and medicine came together and had a joint statement to say, we're not going to, we feel it not ethical at this point because there's no studies to say there's any advantage. But
yeah.
That first week and a half, it was crazy. I didn't get a lot of prescriptions for it per se, but certainly the questions we're asking. I did have a couple prescriptions come in and a few people, but we right off the bat said, no, we're holding this medication, and sorry, this is for patients who need it for things like rheumatoid arthritis.
Correct. And I actually tell my patients, there is a study, I think, going on in Ontario with frontline workers using hydroxychloroquine to see if it'll do any good for them. And I tell my patients, look, wait till the stats come out, wait till the data's there. We just have no idea yet. And they're okay with that.
Right.
Let me shift back to the physical barrier kind of stuff and that. And I know we sort of touched on that already in terms of what you're doing in your pharmacies, but more specifically, let's talk about personal protective equipment for a minute. So, first of all, have you been able to access any personal protective equipment other than what you've been able to purchase on your own? So through, the CDC, the BC CDC, and or other government supply chains. And I'm talking about specifically gowns or face shields, masks and that sort of stuff. And if you haven't, is that something that you think you should have access to? And would your staff feel a lot more comfortable if they had access to that and had some clean, good, new personal protective equipment to put on every day when they came to work?
Well, I'll go first, Colin, but I'll pass it off to you because Colin and I are both compounders. So first of all, we have to protect our people up in the lab because they can't work if they're not protected.
Right.
Second of all, what we do down in the store, because I didn't know we could get any government support to get any PPE whatsoever, we are wearing our compounding gowns in the store to protect our clothing. We cannot get masks. I have masks for my workers upstairs. We cannot get any more masks. So downstairs, if people are wearing masks, they're wearing them for 5-6 days. So we don't have a lot of allotment. I do have gloves, but I don't, if I could try everywhere I possibly can to get more, especially masks, can't get any. Gowns, I'm buying at a horrendous price from back east. And I had ordered this big supply, and they've limited me to a package of 10 of different sizes. So I guess the answer is no, I'm not very lucky at getting equipment, and we're doing the best we can. But we're reusing things because that's the only option we've got. I don't know if it's the same for you, Colin, but it's difficult.
Yeah, that's a good point, Mike. I haven't heard of anything from the government as far as, having a supply for the healthcare workers like pharmacists, I should say, and their staff. We have a small supply of masks that we've put aside for staff use, and some of our staff do use them. The staff that use them primarily are the front store staff, who are a little bit higher risk as opposed to us in the dispensing area, especially now that we've got the plexiglass covers. We have gloves. We got lots of alcohol sanitizer because we've been compounding it in the lab for our use for selling it as well. Yeah, they are good, and that's been working. I haven't been wearing my compounding lab jacket, but I use my regular pharmacy jacket and wash it frequently. But I think we would have a little bit more comfort if we had access to it, because again, the supply chain is dried up on so much of this stuff, right?
Yeah,
There's
for sure. I mentioned the government thing only because I know that the BC Pharmacy Association has been working very hard to advocate for pharmacists to have access to part of the government stockpile of PPE, which is being constantly replenished, as you hear on the news every day. And of course, some of the product that's coming is not even serviceable, depending on where it's coming from. So, I think this idea of reusing PPE, while not optimal, it's happening in a lot of places, everywhere from your pharmacies all the way to hospitals in New York. It's the reality that we're living in now, for sure. So let's move on to maybe a couple of other topics. One thing we wanted to explore a little bit with you guys is prescription delivery. So we're clearly hearing that increase for delivery from pharmacies has gone through the roof for many pharmacies, and want to know if you've experienced increased demand for delivery, and if you have, are you able to cope with the demand that you now have from your patients? Maybe Colin, you can start on that one.
Well, we do deliver. We've always have delivered, and we found, especially in that mid-March to up until about this week, we were almost going twice as many deliveries per day. So for us, a pretty good day was about a 25 person delivery per day. We were hitting 50 through this past period, and that was pretty crazy. Were we able to keep up? Yeah, because I have a fellow who we have on staff who does his deliveries. But definitely an increase. We do offer that. We mention it many times to patients, especially the elderly. Listen, if you're not feeling comfortable coming in, we can deliver for you. And so many of the patients have taken us up, which I appreciate. And it's basically a ring, drop, and go. So our delivery person will ring the doorbell at the person's house, or be rung into their apartment and leave it at their apartment door. And there's no contact for our delivery person with the patient, which is good.
And you don't charge for delivery. You do this for free.
We don't charge for prescription delivery. If it's just like send me, some vitamin C, well, we charge $4 just because obviously, you're not making any money on it. So
yeah.
How about you, Mike? Are you doing it?
Michael, how about you?
So I would say also, we're number one, we're very fortunate because the guy who delivers for us has let a lot of his other stores go, but keeps us and I think one or two others. Because I guess our supply is pretty good for him. So yeah, we're pretty close to double what we've been doing. But he's also very anxious about delivering, and we're trying to keep his deliveries down. So being that we're trying to do a lot of drive-bys, so if people can come by, we're happy to walk it out to the parking lot and give it to them in the car. And a lot of people are helping us out that way. I have to be very honest that we will do free delivery for patients who get their prescriptions through us. But if someone's calling us for a one-off, I just can't afford to make $10 and pay $6 to deliver that prescription. So if people want to get their prescriptions through us, we're happy to do that. We're happy to deliver if we must. But I just can't be delivering, like you would say, Colin, lose $5 on a prescription to deliver. And I've had one situation where someone gets all their prescriptions at another store, but we do the $3,000 injection that we make $10 and deliver for $6. And of course, the family calls us up and we said, look, get the other pharmacist who delivers you get everything from. And of course, they called us up. How could you not deliver during this COVID crisis? And I said, yeah, you're right. You're getting your delivery. But I think after that, we're transferring things out because there has to be some give and take. People have to understand. I mean, we just can't be sitting there losing money. We have to at least break even on these things. So Doing our
No,
best.
for sure. I think you're probably in the same boat as many pharmacies are. And I've heard lots of stories from pharmacists who have had to engage a third party, courier kind of service. And, they're paying in some cases $10 per delivery. And if the person only
Yep.
orders one prescription, that's the whole dispensing fee. I mean,
That's it.
so you're losing money on those scripts because you've got all the labor and everything else that went into that. And I think one of the unfortunate things that we're dealing with in terms of reality is, and all of the complaints that, perhaps the ministers received from seniors about having to pay extra dispensing fees because of a 30-day limitation and so on and so forth, is that we still struggle in this profession with the public understanding that other than the dispensing fee, there really is no margin on prescriptions. And, people see a prescription for $150 and they think you're making, $75 on that prescription. No, the drug cost is $140. The dispensing fee is 10. And, that's a common misperception, I think, amongst the public, which hasn't served the profession well. And, it's also led to many of the issues that we deal with that are related to the fact that lots of people don't see pharmacy as part of the healthcare system. They see pharmacy as part of the retail sector.
Correct.
And it's been a problem for us, and probably since day one, when, by some poor luck on our part, I guess, drugs were not part of the Canada Health Act, and we've had to live with that and adapt the system to that ever since the Tommy Douglas days, and that's where we are, and the days of the start of Medicare. So, Phil, I think you had a couple of other things you wanted to delve into a bit here before.
Yeah, exactly. In terms of day-to-day operations in the midst of all this, have you guys seen a real paradigm shift there, and just normal big picture view of your day-to-day operations? Colin, your thoughts?
Well, there's a lot of different aspects here. I think just procurement of product has been a huge issue, both with the prescription inventory, the drug inventory, and our front store inventory. Trying to replenish stock and trying to get it and be able to buy it when it's not available or seemingly not available has been a real challenge. So that's right through the entire pharmacy. That's been an issue. Staffing was an issue, trying to, get enough staff to get through the big tidal wave that we experienced. And now we're seeing a leveling off of that workload. And now we're fully, maybe overstaffed and trying to manage that, because we don't really know what's happening from day to day. You just don't know. You open up on Monday morning and it could be busy, could be not so busy. It's hard to say right now. So there's a lot of managing of staffing levels, of trying to get the product into the pharmacy, trying to get it onto the shelf, trying to maintain security, because there's been a bit of a rash of theft. Our pharmacy was broken into. We had a burglary in the evening about 2 weeks ago. And that wasn't fun, to be honest. Lost a night of sleep and lost a lot of product and a headache. And so those are some of just the issues that we have. Mike, what do you have in Delta?
Well, I think, you used the word family, and our staff is an extension of our family, and we have a real responsibility to look after them at this time. And, we just can't turn around and say, well, today I'm only doing about 50 scripts, whatever it is. So I have to ask you people to stay home today. That's not how our businesses work. We have a responsibility to these people, because we all know we wouldn't be where we are today if we didn't have these people working with us. So is there staff adjustments? No. The staff adjustments I have is, one of my staff, his wife is having a baby today. One of my staff was working and decided that, I don't feel so good today. Ended up having a fever and a cough. So she's home and found out, of course, all it was a cold, but she's still quarantined for 2 weeks. So, you know what? There's all these fluxes. And what happens is we just have to pick it up, because you can't hire someone for 4 days and say, thanks for coming in, because they don't know your systems anyway. So we're all going to go through these ups and downs and highs and lows, and we're going to have to rely on the rest of our extended family to just pick up the slack and make it work. But you're right. The time we spent trying to procure things, calling all over the country to try and get stuff. It just takes a lot of time. So we're all doing the best we can.
Yeah.
So I have one more question, and going forward, this pandemic will come to an end, hopefully sooner rather than later. But looking ahead, would you guys adapt your business plans differently? Because we know that this one will pass, and we don't have the luxury of thinking it'll never come back. So, is there things that you guys would do differently going forward, Colin?
Oh, that's a tough one. I think there will be, and I think we all need some time to digest all of this. I mean, we're still in the heat of the moment here a little bit. I'm exhausted. My staff's exhausted. To think, we often talk about if we could look back, which we will one day, but we can't right now. But if we could look back, we probably would do things differently. I think we need to be a little bit more prepared for things such as a pandemic, or more likely an actual something like an earthquake. I think this gives us a bit of an idea of what would it be like if something really catastrophic hit this. And I think we are somewhat prepared, but not anywhere near we should be. But I think that time will come after this passes. I don't have a lot of time to look into the future for other things right now.
Yeah, Michael,
How about you?
I think we have to take some time to decompress, hopefully at a point in time where we can see the light at the end of the tunnel. I have a feeling some of the safety measures we've instituted to some degree are going to stay put. Maybe some sense of social distancing in the store. I'm not sure my plastic protector's coming down. I just sense I have this real need to protect my staff and make sure that they can come to work all the time, every day, and feel the sense of security. And so I just think we won't be as stringent as we are right now, but I do not believe we're just going to wipe things out and they're going to go back to where they were. There will be some new implementation for sure. And I think if we have a hint that something is coming down the pipelines, I know Colin's no different than me. We'll be on the horn for gaps and gowns and masks and you name it. I mean, alcohol by the gallons, because that's what we need to get. That's what we need to survive. So it will change our thinking. Us independent entrepreneurs will be jumping on things in a big fat hurry because we're lucky we can change course on a dime. We're not corporately responsible. We can turn around and say, this is what I need to do now, and away we'll go with it. So yeah, we'll be way more in tune to what's coming down the pipeline. That's for sure.
Yeah.
Well, that's great, and I have no doubt that even beyond pharmacy, the new normal when this is all over for everybody is going to be a little bit different, and a lot of perhaps the new habits that people have developed during this period of self-isolation and social distancing and quarantining are things that might persist for a lot of people going on. I know one of the things that my wife and I have noticed is that families are getting out to get some fresh air. We'd see them, out going for a walk or taking the kids for a bike ride or something in their own little family unit as they all live together. And they're pretty good with the social distancing while they're out there, but maybe they're developing new habits of doing things together on a more frequent basis that might persist. And those kind of positive things may come out of this as well. But certainly from a business perspective, I have no doubt that businesses and the way business is conducted in the future is going to change. So it's been very insightful chatting with the two of you today. I want to thank you both, Michael and Colin, for an insightful conversation. We wish you both well for yourselves, your families, and that's both your personal families and your business families and your staff. As we move forward through this pandemic, keep yourselves and your families and your staff safe. And thank you very, very much for all the hard work that you're doing every day to make sure that British Columbians and in fact, all pharmacists, making sure that Canadians right across the country are getting the medications they need when they need them in appropriate quantities and getting the information they need to help themselves navigate through this difficult time for everybody. So that pretty much wraps up this episode of Pharmacy in Flux. Be sure to join us next time when we interview David Pavan, the Deputy Registrar of the College of Pharmacists of BC. Thanks for tuning in.